60 seconds, guess the diagnosis, and as always, answer at the end. Stefania is a 23-year-old female patient. She's been brought in by the paramedics. They were called to the house by the partner. She was unresponsive and on the floor. She wasn't breathing and he was petrified. When the paramedics arrived, chest compressions had already started. On the way on to hospital, electric shocks and medications have been delivered. As the resuscitation team are tending to her, you take the history from the partner. He tells you that Stefania is normally very fit and well. She's a university student and has no underlying medical problems. Over the last week or so, she's thought she's had a urine infection. She's been finding that she's been needing to go to the toilet more frequently. She got some antibiotics for 3 days that didn't clear the infection. He was worried earlier tonight that she was developing into a sepsis. She was a bit more drowsy yesterday and a bit more groggy and confused earlier today. She was having some fevers associated with some nausea and vomiting. There was no pain, but he'd looked online and it sounded like pyelonephritis or infection travelling to the kidney. She felt some chest pain and discomfort with palpitations. The sweating was bad. You ask what she's been up to over the last couple of days. She's been eating and drinking very minimal amounts. She's been experiencing severe joint pains and muscle aches, particularly in the glutes and the quadriceps. As you're talking to him, you look over to her and it looks like the resuscitation team have got her pulse again. She's now intubated and she's been taken to critical care. If I tell you the urinary catheter shows quite dark brown coloured urine, the partner says that she's very fit and well and actually has been focused on eating a very healthy diet, having extra supplements, higher protein intake. Over the last 3 or 4 weeks, she's been preparing for a marathon. She's been doing outdoor running and has increased her time at the gym with a personal trainer. If I tell you this is actually a very common condition, under extreme amounts of stress and exercise, the muscles take trauma. Some of the proteins or muscular fragments break off from the muscles and they go into the bloodstream. The kidneys are responsible for filtering and sieving out any rubbish from our blood. If I tell you these big protein molecules cause significant damage to the kidneys. As a result, patients can get dark coloured urine. In addition to this, the extreme kidney failure can lead to the dysfunction of that organ. Potassium levels can start to rise, and this can be life-threatening because it can cause irregular cardiac rhythms. This condition, have to raise awareness about this condition. A lot of the early symptoms such as the fever, the nausea, the vomiting, the general tiredness can be put down to an infection, but actually there's an underlying muscular damage and associated damage to the kidneys going on. The partner looks at you and says, "Doc, what do you think's going on?" Correct, this is rhabdomyolysis.